Thank you for joining us for the third annual Global Summit, Global Kidney Innovations, Expanding Patient Choices and Outcomes, a collaborative partnership event presented by the American Association of Kidney Patients and the George Washington University School of Medicine and Health Sciences. My name is Jennifer Jones, and I am an AAKP Board of Director, Executive Committee member, and ambassador. I am also a resilience coach, speaker, and retired Marine Corps veteran. 10 years ago, I was diagnosed with membranoproliferative glomerulonephritis type 1 idiopathic after exhibiting symptoms of acute kidney injury, or AKI, while deployed to Afghanistan. Throughout my journey, I have experienced AKI numerous times due to this disease. In fact, this January, I returned to peritoneal dialysis after having 5 years with a kidney transplant. If it weren't for the nephrology team of Walter Reed National Military Medical Center, I may not be here today, and that weighs heavily on me. However, I am hopeful that one day the focus of my treatment will change from mitigating disease to preventative medicine and modalities. As health consumers in the center of patient-centered care, it is crucial that we provide input and gain access to new kidney care innovations. Being part of AAKP allows me access to the education and resources I need to not only improve my quality of life as a patient, but also the platform to use my voice and my experiences in a meaningful way to demand more innovation and more choices for myself and others diagnosed with chronic kidney disease. As an AAKP member, you can do the same. It is critical now that we as patient consumers raise our voices and create the demand for new diagnostics, devices, and biologics in our independent countries. By cultivating a united patient consortium, that demand can be supported globally for patients in countries where healthcare systems and/or infrastructure may not support patient consumer choice and/or access to care and treatments. Today, I am pleased to introduce friend and ally of AAKP, Kevin Kovaleski, Vice President of Commercial Development for Transplant Medicine at CSL Behring, for our session on Emerging Research with Global Implications, CSL Behring, a company committed to improving outcomes for transplant patients. Mr. Kovaleski, you may start your presentation.
Hello, and I want to thank the American Association of Kidney Patients for allowing me to present to your group today. It's always great to be able to present to patient groups that we can help in some way with our therapeutic product. My name is Kevin Kovaleski, and I'm Vice President and co-lead of the Transplant Therapeutic Area at CSL Behring. And today, I'm going to give you a little overview of who we, all the people that make up CSL Behring, are, and how we intend to be able to help the patients like you in the future. So there's a little legal disclaimer that I'm obligated by all of our lawyers to present to you today. Who are we? Most of you probably have not heard of CSL Behring. As we like to say, we're the largest pharmaceutical company that most people haven't heard of. We're not an everyday name, but for those patients who are helped by our products, they know us and they appreciate everything we do. But CSL is a global specialty pharmaceutical company that's focused on rare disease states. And our intention is to develop therapeutics that help patients live longer and fuller lives. CSL is actually made up of 3 subsidiary companies: Seqirus, which is our vaccine manufacturer; CSL Behring, which is the company that I work for; and CSL Plasma, which is our plasma collection organization that provides the raw materials for most of the products by which we then turn into therapeutics to help patients. At CSL Behring, everything we do is driven by our 5 key values, those being patient focus, innovation, integrity, collaboration, and superior performance. CSL Behring's legacy is more than 100 years old. Our organization was started back in 1916 by our namesake, Emil von Behring, who was the first Nobel Prize winner for medicine. As you can see, over the years, we've grown a lot. but we remain committed to our core promise to patients. As you can see, CSL Behring is a large global organization with more than $9.1 billion in annual sales. But we're committed to reinvesting significant amounts of that money to try and find new therapies to help more people. And in fact, last year, we invested over the last 5 years, $3.7 billion in research and development to try and find new therapeutics to help patients in need. Every day, the 27,000 employees of CSL Behring come to work committed to finding new therapeutics and to help those in need. And in order to provide the raw material for many of our products, we at CSL Plasma have over 270 plasma collection centers throughout the world. We have the largest plasma collection network in all of the industry. As a global company, we have a footprint in more than 35 countries worldwide. In this slide, just goes to show a snapshot of all of the different locations where we have offices and staff throughout the world. In fact, our headquarters for CSL is in Melbourne, Australia, and our operations center for CSL Behring is in King of Prussia, Pennsylvania, a suburb of Philadelphia. As I mentioned, at CSL Behring, our 27,000 employees are driven by our promise to our patients, our promise to our employees, our promise to our shareholders, and our promise to our stakeholders, and all of the partners that we have in order to bring the therapeutics to the patients who need them. More than a century ago, CSL Behring made a promise to protect the health of those stricken with a range of serious medical conditions. And today, as a leading biotherapeutics company, that promise has never been stronger. As with any large global organization, we need to be focused. And for our company, we are focused on 5 key therapeutic areas. Those are immunology, cardiovascular and metabolic, hematology, respiratory, and transplant medicine. Today, I'd like to talk to you a little bit and give you more information about our transplant TA specifically. Transplant medicine has been demonstrated and proven to be an effective, life-saving therapy for those with organ failure. In the United States in 2019, there were nearly 40,000 solid organ transplants, and about 60% of those were kidney transplants. As you can see with the graph on the left, the number of transplants over the period from 2009 to 2019 has grown 39%, and more than 23,000 kidney transplants were done in the United States in 2019. The reason so many transplants are done is because we know that they work. If you look at the graph on the right, the yellow line shows the number of deaths per 1,000 patients for patients who have had a transplant. You can see how low that is compared to the green line at the top of the chart that is patients who remain on dialysis. So we know that transplant works. However, there just simply aren't enough organs to give everybody a transplant who needs one. In fact, there are more than 600,000 patients on dialysis in the United States right now, and globally more than 1.2 million people per year die from kidney disease. Not only is transplant life-saving, it also is cost-effective. For healthcare payers around the world, spending on dialysis is a significant portion of their budget. In fact, the United States alone, US Medicare spending for patients with end-stage renal disease in 2018 was $36 billion. So you can see the amount of resource that is required in order to manage patients with kidney disease. And for those patients, transplant could be a very important and viable option. So, as I've shown on a previous slide, transplant continues to grow. Globally, in 2018, there were nearly 143,000 transplants. And that's expected to grow to over 200,000 transplants in the year 2030. But the number of patients who are on the wait list continues to grow. The demand for organs simply is far greater than the supply. But there are things that we can do, and there are things that CSL Behring is committed to doing. Because organ discard, the number of organs that are actually donated but not used is still significant. In fact, about 18 to 20% of organs donated, kidneys donated in the United States, are actually discarded. And roughly only about 25% of lungs that are donated for transplant are used. Those numbers need to improve. And part of that needs to happen with therapeutics that help make these organs more viable for transplant. Additionally, legislative and advocacy efforts to try and increase donation could significantly impact the number of organs available. If you look at the global donation rates in different countries, for instance, Spain, one of the highest countries in terms of donation in the world, where nearly 47 people per million donate organs. In the United States, the number is about 32 people per million. And in other countries, such as Germany, where it's less than 10 people per million that donate. So if we can get those numbers up to closer to 35 to 40 people per million, you can see the impact it would have on the ability to get more people transplanted. Additionally, our company is focused on trying to help those patients who've already received a transplant to keep that graft longer and to keep those patients alive longer. Now, admittedly, this is a bit of a jumbled slide, this graph. However, if you look at the lowest line on this chart, which shows patients who have antibody-mediated rejection, the survival of those patients is far worse, significantly worse, than patients who don't have antibody-mediated rejection. And antibody-mediated rejection is responsible for most allograft failure for kidney patients. It's because of that our company has invested in a clinical trial that's currently ongoing, a randomized, multi-center, double-blind, placebo-controlled phase 3 study of clazakizumab, which is a novel anti-IL-6 monoclonal antibody for the treatment of chronic antibody-mediated rejection. This new product, if approved, would have only once monthly subcutaneous dosing. Additionally, if this product is approved, it may be the first new product approved for kidney transplant patients in the United States in over a decade. Patients need products like this, and it's companies like CSL Behring who are delivering upon the promise to bring new therapeutics to market for those patients who need them. It's through studies like the IMAGINE trial, looking at clazakizumab as a treatment for chronic antibody-mediated rejection, that we believe that we can deliver upon the mission that we have for the transplant TA at CSL Behring. And that mission is very simple: to become a recognized leader in transplant medicine by 2030 by bringing innovative products to market that dramatically improve patient outcomes through better graft availability and long-term graft and patient survival. So I hope that this information today was able to give you a little better idea of who CSL Behring is. And I'm very hopeful that for those of you who are either have or will be getting a kidney transplant in the future, that someday that we may be able to help you and that our name may be more recognizable in this community. Until then, thank you and stay safe.
We appreciate Mr. Kovaleski for taking the time to share his insights and expertise. Thank you.
Thank you very much for joining the American Association of Kidney Patients and George Washington University School of Medicine and Health Sciences for this, our third annual Global Summit on Kidney Disease Innovations. The engagement of this audience worldwide is fundamentally important to the success not only of our future summits, but more importantly, to patients who are suffering from kidney diseases. Around the world, the cost and the burden of kidney disease is increasing, and it's been accelerated by the pandemic of COVID-19. Medical professionals around the world are under tremendous pressure. Researchers are under tremendous pressure. Everyone is racing for solutions, not simply for the immediate and the short term of COVID-19, but for the long-term implications, including implications for kidneys. This additional burden on kidneys worldwide and on patients is on top of a growing epidemic of kidney diseases. What's going to solve this problem? To put it really bluntly, it's going to take all oars in the water, pulling as hard as possible. But one of the strongest forces in that equation is the voice of patients and the energy that we bring to helping solve problems, not simply for ourselves, but for those who have yet to be diagnosed. And that's what this is all about. Patients around the world working as patient consumers who are informed about the science of their disease, about the implications for their families, have a very unique role to play. Our voice is the voice that must be heard by regulators in government, payers, whether they're in the private sector or the government, and they must be heard by those who are struggling every single day to try to bring treatments to us. Our voice needs to back up and be an advocate for the medical professionals, the researchers, the young scientists, those who are thinking about getting into this space, and most importantly, those of us who know, who can have an impact on kidney disease. We must be a voice for patients that don't have the energy and may not have the knowledge or the technology to speak up to their governments. Together worldwide, we can make an impact. Let me give you some examples here in the United States, just in the past 10 years, what an organized group of patients has been able to do, working in collaboration with medical professionals. In less than 10 years, we've been able to make HIV to HIV organ transplants possible, so those who are suffering from HIV can have life-saving kidney transplants. We changed the law. We've been able to get immunosuppressive drug coverage for the life of the transplant. Just in the past year, that was a 20-year fight, but kidney patients made that happen working with their elected professionals. And kidney patients worked diligently with labor leaders and the U.S. Department of Labor to make certain that the Family Medical Leave Act was interpreted and extended to those individuals who are called to be living organ donors, the selfless heroes that donate their organs and their kidneys to keep patients alive. Right now, we're fighting in the U.S. Congress to make certain that all kidney donors, all living kidney donors, whether they're insured or not insured, are provided with the protections of law here in the United States to make certain they're not discriminated against in life insurance, disability insurance, and health insurance. It's a proud battle, and we're going to win it. These are just a few of the examples of what we've been able to achieve here in the United States, working as a united front of patients with other stakeholders in the kidney community. We are absolutely convinced, as you've heard from our European partners in our European kidney allied patient groups and other patient groups around the world, we are convinced that we can help drive solutions and get those solutions into the hands of medical practitioners and patients so we can save more lives, prevent more disease, and allow people to pursue their aspirations and their goals across the globe in whatever country they live in. We know that the patient voice can have an impact because it has. We know the patient voice will have an even greater impact because we're getting organized, we're using better technologies, and we have a better sense of ourselves of what we can achieve. And for the patients that are listening that haven't had a chance to get engaged yet in clinical trials and research, understand this, that the research community worldwide and the medical community worldwide, they need us. They need us right next to them. And the dynamic of viewing patients somehow as no longer having importance or the same importance or voice, that's falling away. And what's emerging is a greater sense and appreciation for patient insights, and the value that we have and our life experiences have. I ask you to join us at the American Association of Kidney Patients as we build a worldwide consortium of patients. We're driving for a lot of things. We are going to get artificial, wearable, and implantable kidneys within the next 10 years. It's one of the reasons why the American Association of Kidney Patients started the Decade of the Kidney. We declared it so in 2019, and we've dedicated ourselves by 2030 to working around the globe with researchers and medical professionals and fellow patients to make certain that we can make that happen. We're in the business of saving lives, of inspiring other people, and making certain our voice counts. Your voice counts too. Whether you're a patient or a caregiver or a family member, I encourage you, join us. It takes all oars in the water pulling in the same direction, but the greatest power in that boat is the voice of the patient and the example of the patient. So thank you very much. As a fellow kidney patient, my hats go off to you around the world. I'd like to especially thank Dr. Dominic Raj, the Dean of Medicine at George Washington University. I'd like to thank Dr. Bass, thank my fellow patients, Richard Knight, and until our next Global Summit, keep speaking, keep active. Thank you.